Finally, in Nigeria, a healthcare startup is providing consultation and treatment facilities, essentially for rent. Doctoora, as it's called, also provides a platform for people to find and book appointments with private healthcare professionals. It's effectively bridging the gap between medical practitioners and their patients. Here's CGTN's Deji Badmus with that story.
The idea is some kind of revolution in Nigeria's health sector. Doctoora also allows health professionals to rent fully serviced medical facilities on a pay-per-use basis after a verification process. In turn, it takes a commission of the fees paid across the platform. Founded by medical doctor and healthcare consultant Debo Odulana in 2016, Doctoora aggregates the spare capacity in private hospitals to provide foreign and local practitioners with the ability to deliver services without incurring setup costs.
With Doctoora, a doctor can easily book a place to use in any of our locations and see the patients whenever they need to see the patients at these locations. What this does is it allows foreign-based professionals and the ones that are based in Nigeria also move around within the country to deliver services.
Currently operational in 3 cities in Nigeria, Doctoora works with facilities in 30 different locations. Ultimately, the aim is to create the kind of service that equates to the ones that people often seek abroad.
$1.3 billion is being spent by averagely 50,000 people on medical treatments abroad. We are losing money. Some of the money we are losing can be returned. So if we can bring professionals in to the country or aggregate the professionals in the country that have the skills, we can deliver that value and reduce the amount of money we are losing.
In one of its centers, Doctoora has successfully conducted 169 kidney transplant surgeries. And Dr. Debo believes achievements like that can gradually revive the lost confidence in the Nigerian healthcare system.
At this center where we've done a lot of kidney transplant surgeries, we've also noticed that most of the time there are very empty rooms in that facility. So how can we take this underutilized extra capacity and use it to create more services for people who would otherwise not have access to healthcare?
Over 187 vetted health and wellness professionals have signed up on the platform, and there's really no limit to the kind of service that can be found on Doctoora. Here, a patient is being attended to by one of the doctors signed to the platform. The board explained how the Doctoora platform has been of help to them.
If I were to float a clinic now, I'll be looking for huge sums of money. You need to pay rent, you need to buy equipment, all of that. But they have come into the sector now to say, okay, come, we have facilities, just come, see your patients, collect your money, pay us a certain amount, and everybody goes home fine.
Bringing this initiative, bringing this platform, making me book whenever I want, making me see the doctor I want, it's a welcome initiative. Just come, see a doctor, and then at your convenience, there's no rush, and that's the wonderful thing about it.
The fact that Doctoora essentially brings the doctor to the patient and not the other way around, as is usually the case, is quite innovative. And in offering this kind of service, Doctoora is not just increasing the clientele of medical professionals, but also reducing the rate at which healthcare workers leave the country.